Have you ever felt your heart suddenly racing while you were just sitting quietly in your favorite chair? Or maybe you stood up too quickly and the room spun longer than it should have. These little moments might seem harmless, but sometimes they're quiet whispers from your heart, asking for help. You see, heart failure doesn't always begin with a dramatic heart attack or an emergency hospital visit. More often, it starts quietly with small signals that are easy to miss. And that's what we're talking about today, spotting those early, silent clues before they turn into something serious. No complicated medical jargon, no scary numbers. Just a calm, honest conversation about what your body be trying to tell you. Because when it comes to your heart, ignoring the little things can lead to big consequences. If you're ready to listen closely to what your heart might be saying, type 1 in the comments. If not, type 0. And don't forget to subscribe to Health 365 so you never miss important health tips. Number 1. A resting heart that races. When your heart gets tired, it doesn't always hurt. Sometimes, it just beats faster, like a worker rushing to finish a job. Normally, your resting heart rate should stay between 60 and 100 beats per minute. But when the heart is weak, it pumps harder even when you're sitting still. That's when you might feel pounding, fluttering, or racing out of nowhere. Over time, this constant overwork makes the heart weaker. If you notice your resting rate often above 100, write it down and mention it to your doctor. A small step like this could make a big difference. No. 2. A foggy, forgetful mind. Have you ever walked into a room and completely forgotten why? Or found it hard to follow a conversation? Many people assume it's just aging, but sometimes it's a sign your heart isn't pumping enough oxygen-rich blood to your brain. This lack of circulation can leave you foggy, forgetful, or unfocused. It's not just absent-mindedness, it's a possible warning. Tracking when this happens after exercise, in the evening, or during stress helps doctors connect the dots between your memory and your heart health. No. 3. Swollen ankles and feet. By the end of the day, do your socks leave deep marks around your ankles? Or do your shoes feel tighter at night than they did in the morning? That swelling is called edema, and it's often an early red flag for heart failure. When the heart struggles, blood backs up and pushes fluid into your legs and feet. If pressing on your shin leaves a lasting dent, it's worth telling your doctor. Your legs may be revealing what's happening inside your chest. No. 4. Dizziness or lightheadedness. Do you ever stand up and feel like the world tilts for a moment? These dizzy spells may mean your heart isn't pumping enough blood to your brain. Left unchecked, this raises the risk of fainting and falls. Keep track of when it happens after standing, walking, or bending and share it with your doctor. No. 5. Waking up often at night to urinate. Do you find yourself running to the bathroom multiple times a night? This isn't always just aging. It can happen when fluid in your legs moves back into your bloodstream as you lie down, making your kidneys work overtime. If you're waking up 3 or more times every night, it could be a sign of fluid buildup from heart failure. No. 6. Cold hands and feet. If your hands or feet stay cold even in warm rooms, it may be because your heart is saving blood flow for vital organs, leaving your extremities with less. If this keeps happening, don't ignore it. No. 7. Shortness of breath with simple tasks, walking to the mailbox, climbing a few stairs, or carrying groceries shouldn't leave you breathless. But when the heart can't pump properly, fluid builds up in the lungs, making even small efforts exhausting. No. 8. Needing extra pillows to sleep. If you can lie flat in bed without struggling to breathe and need 2 or 3 pillows just to feel comfortable, that's another red flag. Some people even end up sleeping upright in a chair, This isn't normal aging. It's your body telling you that your heart is under strain. No. 9. Sudden, unexplained weight gain. Have you gained 2 or 3 pounds overnight, even without eating more? That's often fluid buildup, not fat. Doctors warn that gaining more than 5 pounds in a week can signal heart problems. Daily weigh-ins are a powerful way to catch this early. Number 10. Feeling bloated or losing appetite. If you feel full after just a few bites, it may not be your stomach, it may be your heart. Fluid buildup in the belly can cause bloating, pressure, and even loss of appetite. Number 11. Nighttime cough or wheezing. A dry cough or wheeze that worsens when lying down can signal fluid backing up into the lungs. If cough medicine or inhalers don't help, the heart may be the cause. And finally, number 12. Struggling to breathe when bending forward. If you feel out of breath while tying your shoes, gardening, or bending down, it could be bendopnea, a surprising but common early warning of heart failure. If any of these symptoms sound familiar, it's important to remember that they can also be caused by other conditions. This list is not a substitute for professional medical advice. It's meant to raise awareness and encourage open conversations between patients and doctors. After all, your heart deserves all the attention and care you can give it. Now let's shift our focus to something you can do right now to support your heart health. Close your eyes, take a deep breath, and try to picture the most peaceful scene you can imagine. Maybe it's a serene beach, a quiet forest, or your favorite cozy corner. Hold on to that feeling for a few seconds, letting the tension in your shoulders and forehead melt away. Now open your eyes and bring your awareness to your heart. Imagine it as a source of light, radiating warmth and strength within your chest. Repeat this visualization whenever you need a calming moment, especially when anxiety or stress tries to overshadow your well-being. Some people think that being calm is just about avoiding stress, but true calm goes beyond that. It's a daily practice of self-awareness, emotional resilience, and finding joy in the present moment. Cultivating inner peace isn't just a feel-good goal. It's a powerful tool for maintaining physical health. Research shows that chronic stress can wreak havoc on the body, from raising blood pressure to weakening the immune system. On the other hand, practices like mindfulness, meditation, and yoga have been proven to reduce stress hormones and promote overall well-being. By incorporating these practices into your daily routine, you're not just finding calm, you're actively safeguarding your health. So go ahead, embrace the power of calm. Let it guide you in managing stress and nurturing your well-being. Remember, every small step counts and your journey towards better health begins with you. One last thing, we know that knowledge is the first step towards better health. That's why we've created a free guide called Your Heart Attack Survival Kit. It's filled with practical tips and insights that could save your life. We cover everything from recognizing the warning signs of a heart attack to what to do in the crucial minutes before emergency help arrives. Plus, we bust common myths and misconceptions that could put your health at risk. We want everyone to feel empowered and prepared, because your heart deserves all the attention and care you can give it. Grab your copy of the Your Heart Attack Survival Kit today and be a proactive member of your healthcare team. Your heart health is in your hands.